Hello, my name is Matt Strela from Stanford University, and this lecture is on the systematic approach to ECGs, ventricular rhythms. So let's get started. In a ventricular rhythm, it's where the epicenter of the rate or controlling center of the heart's rhythm is starting in the ventricle. These are typically very slow rates, and the intrinsic ventricular rate tends to run around 40 beats per minute. So what you're going to see then on an ECG, because it's not using the normal electrical pathway of the heart or the bundle branches, right, the superhighways, is a wide QRS complex. And as we said, that rhythm typically runs around 40 beats per minute most of the time. Now, monomorphic ventricular tachycardia is when there's a single area or focus in the ventricle that is controlling the heart rate, but it's fast. Now again, you can see that it's not using the normal electrical pathway, so it's not using our superhighways. So we know that we're going to see a wide QRS complex. And what we're going to see with monomorphic ventricular tachycardia is it tends to be very regular, that the rate is very fast, often greater than 140 beats per minute, and that the QRS is very wide, frequently greater than 140 milliseconds in width. Now, polymorphic ventricular tachycardia is not perfectly represented here, but that's where there's multiple foci or changing foci of areas in the ventricle that are controlling the heart. And so what you're going to see here is this wide changing QRS complex. It's not using the normal electrical pathways, and the axis is changing. So it almost looks like it's twisting. So sometimes this is called torsade de pointes, or twisting of the points. Although monomorphic ventricular tachycardia is a high-risk rhythm as well, polymorphic ventricular tachycardia is a very high risk for changing to ventricular fibrillation. So what is ventricular fibrillation? Well, ventricular fibrillation is where there is no organized electrical activity in the heart, and there's just multiple areas, similar to atrial fibrillation, but this time going on in the ventricle, multiple areas that are just firing simultaneously electrically. And because of this, you're going to see no organized contraction of the heart muscle, and so no real cardiac output. And here's what you'll see on the ECG. This is an example of coarse ventricular fibrillation. There are never pulses present when the patient is in ventricular fibrillation, because as we said, there's no organized mechanical cardiac activity, and so you're not going to have a pulse in ventricular fibrillation. Now, fine VFib is where on the ECG you can see small ventricular fibrillation waves, but you might actually mistake this for asystole, and it's always good to check this in another lead. So in summary, ventricular rhythms, they have a very wide complex, greater than 140 milliseconds. They're very regular. They're often very fast, greater than 140 beats per minute, or very slow, with the intrinsic ventricular rate typically around 40 beats per minute. And ventricular fibrillation is not organized, and the patients are always pulseless. Thank you.